Namaste, I am JVN Dr. Priyanka BAIRWA from Faculty of Physiotherapy and Diagnostics. Today I am teaching you a topic which is neurological investigations. So let's start. Firstly, we will include these topics in the neurological investigation. First is clinical neurophysiology, in which we include electroencephalography, electromyography, nerve conduction studies, and repetitive nerve stimulation. And also we include evoked potential. Second is imaging. In this topic, we include X-rays, CT scan, and MRI. Third topic is facial tests, in which we include blood test, CSF analysis, and biopsy. So in this video, we majorly include CSF analysis. So firstly, we will talk about indications of CSF analysis. Diagnosis of the meningitis, inflammatory disorders like Guillain-Barré syndrome or multiple sclerosis, subarachnoid hemorrhage, hepatic encephalopathy, meningeal meningitis, paraneoplastic disorders, or suspected abnormalities of the intracranial pressure. Assessment of the response to therapy in the meningitis and other infective or inflammatory disorders. Administration of the intrathecal medications like the chemotherapeutic agent and antibiotics and radiologic contrast media to reduce CSF pressure. So then we will start about contraindication. So, suspected intracranial mass lesion. In this situation, performing a lumbar puncture can be hidden incipient transtentorial condition. The local infection overlying the site of puncture. Under these circumstances, the cervical and intestinal puncture should be performed instead. Coagulopathy, clotting factor deficiencies, and the thrombocytopenia below 2000 per mm cube, a rapidly falling platelet count, should be corrected before the lumbar puncture is undertaken to reduce the risk of hemorrhage. Suspected spinal cord mass lesion, lumbar puncture in this case should be performed only in the association with the myelography, which is used to determine the presence and level of structural spinal neuropathy. With the cooperative patient, the lumbar puncture can generally be performed by one person. An assistant can be helpful in positioning the patient and handling the CSF sample. Of course, especially in the patient is uncooperative and frightened. The lumbar puncture is usually performed with the patient in the lateral diverticulous position and lying at the ease of the bed and facing away from the person performing the procedure. The patient's lumbar spine should be maximally flexed to open the intervertebral space. Occasionally, it is desirable to perform lumbar puncture with the patient seated. In this case, the patient is seated on the side of the bed, bent over a pillow that rests on a bedside table, while the physician reaches over the bed from the opposite side to perform the procedure. The usual practice is to enter the L, L3, L4 or L4, L5 interspace. Since the spinal cord tonus medullaris terminates at about the L1 L2 level in the adult. Thus, the procedure is performed without danger of the puncturing the cord. The L3-L4 interspace is located at the level of the posterior iliac spine or posterior iliac crust. Ideally, blood and CSF glucose levels should be measured in the sample obtaining simultaneously after the patient has fasted for at least 4 hours. Now we will talk about complications. Unsuccessful therapy make obesity, degenerative diseases of the spine, previous spinal surgeries, recent lumbar puncture, and dehydration can make it difficult to perform lumbar puncture. Atrial and venous puncture. If the needle enters a blood vessel rather than the spinal subaerogenous space, it should be withdrawn and new needle should be used to attempt the test at the different level. Patients who have coagulopathy or are receiving aspirin or anticoagulants should be observed with the particular care for this sign of the spinal cord compression from spinal subdural or epidural hemorrhage. Post-lumbar puncture headache. A mild headache worse in the upright position but received by the recumbent is not uncommon following lumbar puncture and will resolve spontaneously over a period of the hours and days. Analysis of result. CSF is normally clear and colorless. It may appear cloudy or turbid with WBC count that exceed about 200 per microliter. Color can be imparted to the CSF by hemoglobin pink, bilirubin yellow, or rarely melanin black. CSF pressure in the lumbar region does not normally exceed 180 to 200 mm. Pathological conditions associated with the increased CSF pressure include intracranial mass lesions, meningoencephalitis, subarachnoid hemorrhage, and pseudo uh, thermosalvi. The CSF normally contain up to 5 mononuclear leukocytes, lymphocytes, monocytes per microliter, no polymorphonuclear cells, or no erythrocytes. Erythrocytes may be present, however, if the lumbar puncture is traumatic. The normal CSF is sterile so that in the absence of CNS infection, no organism should be observed with the various stain. CSF protein is between 15 to 45 mg per dl. CSF sugar is 2/4 to blood sugar. Okay, if we found bloody CSF, if the lumbar puncture yields bloody CSF, it is crucial to distinguish between CNS hemorrhage or traumatic tear. The field should be watched as, as it leaves the spinal needle to determine whether the blood cleared, which suggests a traumatic tear. This can be established with the greater accuracy by the comparing cell count in the first and last tube of the CSF obtained. A marked decrease in the number of the red blood cells support a traumatic course. The specimen should be centrifugal promptly and superintended exam. With a traumatic lumbar puncture, the superintendent is colorless in contrast following CNS hemorrhage and enzymatic degradation of the hemoglobin to bilirubin institute rendered the superintendent yellow. Xanthochromia. Other causes of CSF xanthochromia include jaundice with the serum bilirubin level above 4 to 6 mg per dl. CSF protein concentrations greater than 150 mg per dl and rarely the presence of the carotene pigments. So this is the diagram. Uh, this is the position for the lumbar puncture, and this is the cross section of the spine. Um, you can see this is the spinal cord. This is the lumbar vertebra, third lumbar vertebra, and this is the fourth lumbar vertebra. And this is the needle which is insert in the spinal cord, and we will take by this needle the sample of the spinal cord, CSF fluid. So this is the needle for this CSF. So if you have any concern about this topic, you can ask me to comment in the comment box. And thank you. So Shahid. Okay, namaste. Okay, fine. Namaste. ठीक है